Hi there. This video is a quick introduction to the overall geography of the emergency department. Before your first shift, make sure your computer code works. Bring your stethoscope and maybe some trauma shears and maybe a little snack. Now remember, the ER is a big place and it's easy to get lost, so let's focus on the main sections you'll be working in. You'll be spending most of your time on the A side, the B side, or the critical care rooms. If you ever get lost, just ask. The first place to know about is the resident lounge. This is on the A side. The combination to the door is 0008 hashtag. People often leave their bags here, and that's fine, but keep your valuables with you. Many people use this area to rest, eat, and teach. The next most important place is the staff bathroom. It's located here on the A side, but there are also many patient bathrooms that you can use in a pinch. Let's look at the A side a little more closely. It has an interior core where the attendings, residents, and other providers work. The nurses can usually be found at the desks just outside. The most important person to know is the secretary. They place consultation pages for us, answer phones, and relay messages. Be nice to them. The A side has patient rooms 1 through 15 and 2 procedure rooms. The supply room is located here. This is where you get things like suture trays, bandages, syringes, needles, and various other items. The ambulance triage area is over here, and the IV carts are located here and here. The B side is a lot like the A side with a few crucial differences. This side has rooms 16 through 31. The waiting room is just next door. The secretary is usually over here. The procedure room on the B side is located here, and the IV carts are here and here. One of the most important things that's on the B side only is the tube system. This is how we send specimens to the lab. And because lab results are a rate-limiting process in patient treatment and disposition, you need to know how to use this tube system. Place a signed and labeled lab specimen in a laboratory bag and put it in one of the pneumatic tubes. Make sure both ends click shut. Then put it in the rack and push the Stat Lab button. It should be on its way in about 30 seconds. Sometimes you might be asked to transport a patient to the X-ray area. It's down this way. Once you get there, park the patient's stretcher and let the staff know that they've arrived. Make sure it's okay with your team before transporting the patient. Speaking of transport, here are the basics of stretcher operation. You'll be doing this a lot. You can lower the side rails by looking for a little tab on the side and lifting it up. You can raise or lower the head of the bed by squeezing the handles just behind the patient's head. You can lift the entire stretcher by using this pedal, and you can tilt the head of the bed down by stepping on one side of this pedal, the feet down by stepping on the other, and lower the whole thing by stepping on the middle pedal. Stretchers are normally locked so they don't roll around. If you want to move the entire stretcher, flip it to the neutral position in the middle like this. If you want to push the stretcher somewhere and steer it yourself, push the green side of this lever all the way down to make it easier to manipulate the stretcher without crashing into things. The last area of the ED that you'll be exposed to is the critical care area. Critical care rooms 1 through 6 are for the sickest patients. Each room has its own set of supplies, but you can find unusual equipment items like ultrasound machines over here. You should also know how to find the CAT scan area and the radiology reading room. Okay, that's enough of this for now. No one's going to expect you to commit all of this to memory, but just go over it a couple of times before your first shift and you'll be ready to hit the ground running. Good luck.